Have you ever really thought about what happens after your doctor writes you a prescription? It seems pretty simple, but there's this whole secret life to that single dose. It's a journey through this complex system of checks and balances, and it's all designed for one thing: your safety. So today, we're going to follow that pill.
So, you probably think it's a straight line from the doctor's pen to you, right? Well, there's this entire unseen world of safety checks going on. So what really happens behind the scenes? Let's pull back that curtain.
Every single pill's journey starts with that prescription. But this is way more than just a piece of paper or a click in a computer. It's the first, absolutely critical link in a long chain of safety, and it has to be perfect.
Now, here's something you might not expect. You think about patient rights, but this whole system, it's actually built on the rights of healthcare professionals. It all kicks off right here, with their right to get a prescription that is 100% clear and complete. No guesswork allowed. Period. That single idea is the bedrock of the whole system.
So, who's the main guardian of this whole process? That would be the nurse. And you should totally think of them like a pilot doing a pre-flight check. Before that pill can even think about taking off, a critical safety checklist has to be run.
And at the heart of that checklist are 6 fundamental rights. Now, these aren't just suggestions. They are hard and fast rules. And they're designed to empower the person giving you that medicine to stop any errors before they can even happen. We've already seen the first. Right, a clear order. Others guarantee they get the right drug and the right dose for the right route from the pharmacy, and that they have access to all the information they need. But maybe the most powerful right of all is this one: the right to just stop everything, think, and be vigilant. It's like a built-in emergency brake for patient safety.
So, why all this intense focus? Why so many checks? It's because of these guys, the villains of our story, what we call high-alert medications. Now, they're often totally necessary, but an error with one of these, we're talking powerful narcotics or IV chemotherapy drugs, can cause serious, significant harm. This entire safety system is the defense force built to stand against them.
All right, so the order is in. Next, that order has to become a physical pill. How that dose gets prepared is our next big safety checkpoint, and it's a step that has changed, really changed, to prevent mistakes.
Back in the day, the stock drug method was pretty common. I want you to picture large bottles of pills in a hospital ward with nurses handing out doses to a bunch of different patients, all from the same container. Yeah, the chance for error was pretty high. Today, the gold standard is the unit dose method. Each and every pill is individually wrapped and labeled for one specific patient. It's a simple change, but it's a huge leap forward in cutting down the risk of mix-ups. But there's another sneaky danger lurking on that pharmacy shelf: drugs that look alike and sound alike. It is a huge risk for confusion, and it's exactly the kind of mistake that this new individually labeled unit dose system is designed to catch. And this, of course, brings us to the classic, legendary problem of doctors' handwriting. Now, electronic prescriptions have helped a ton, but this just reminds you how easily a simple misread could lead to the wrong drug being given out. It just proves that clarity at every single step is completely non-negotiable.
Okay, so we've got the correct drug prepared in the correct dose. Check. Now, how does it actually get into the body? The route of administration is the next critical decision in our pill's journey. Get this, a whopping 80% of all medications are taken by mouth. And it makes total sense, right? It's simple for the patient, it's usually less expensive, and the drugs are pretty easy to store. It's the route we're all the most familiar with.
But even with a simple pill, there is a critical safety question that everybody should know the answer to, especially if you or someone you know has trouble swallowing tablets. And that question is, to crush or not to crush? The answer can be the difference between a helpful dose and a dangerous one. So, here's the key takeaway. If you ever see any of these letters on a medicine label, ER, SR, XR, you get the idea. That's your stop sign. Do not crush it. Those letters stand for things like extended release. The pill is actually engineered to dissolve slowly over hours. Crushing it basically shatters that technology, and bam, you get the entire dose all at once, which can be really dangerous. Of course, pills aren't the only game in town. You've also got transdermal patches that deliver medicine right through the skin. They're awesome for keeping drug levels really consistent. But here's the pro tip. You always have to rotate where you put the patch and clean the skin before putting on a new one. It prevents irritation and makes sure it's absorbed properly.
Now, when pills just aren't an option, we turn to what are called parenteral routes, which is really just a fancy way of saying injections. And where you inject makes a huge difference. It could be just under the skin for something like an allergy test, into the fatty tissue for insulin, deep into a muscle, or for the absolute fastest action, right into a vein. Every route changes how the drug works.
Okay, we've followed the pill all the way to the patient. You'd think we're done, right? But nope, the safety process is not over yet. This final part of the journey is all about closing the loop to make sure everything stays safe.
This is where a really important process called medication reconciliation comes into play. Think of it like a final, super thorough audit. A professional compares the new medication orders against every single other thing the patient is taking, other prescriptions, over-the-counter drugs, even vitamins and supplements. The goal is simple: catch any potential mistakes, like duplications or dangerous interactions, before they can cause a problem.
And finally, what do you do with leftover pills? Well, you can't just toss them or flush them. Safe disposal is the final act. The rules are pretty simple. First, always check the label. Second, and this is a big one, do not flush drugs down the toilet unless it specifically tells you to. It really pollutes our water. Instead, here's a little trick. Mix the pills with something gross like used coffee grounds, seal them in a bag, and then you can throw it out. And of course, always scratch out your personal info.
So we followed the pill through its entire secret life, this whole journey protected by rights and checklists and careful procedures. And that brings us to one final thought. Now that you've seen the system, now that you know how it's all designed to protect you, how can you be a better, more active partner in your own healthcare safety?